As a brain doctor, I must tell you that stroke is one of the most frightening medical events because it can strike without any warning. Around the world, strokes are among the leading causes of death and disability, claiming lives in minutes and leaving survivors with lasting damage such as paralysis, speech loss, or memory decline. What makes stroke so terrifying is not just its speed, but the fact that many of the causes build quietly for years before suddenly erupting into crisis. When blood flow to the brain is blocked, or when a vessel bursts, brain cells begin to die almost immediately. Every passing minute means more damage. And in just 1 hour, the loss can be irreversible. Yet here's the truth many people overlook. Stroke does not appear out of nowhere. It is the predictable result of hidden causes, some related to chronic conditions like high blood pressure, diabetes, or heart disease, and others connected to daily habits such as smoking, poor diet, or lack of movement. These causes may feel harmless in the moment, but over time, they silently weaken the arteries, raise blood pressure, and create the perfect conditions for a clot or a bleed to occur. The hopeful truth is that many of these risks can be controlled, reduced, or even eliminated with the right choices in medical care. In this video, I will walk you through the hidden causes of stroke and the 12 most important risk factors you need to understand. Some of them may surprise you, and some may even apply to your own life. Before we continue, I want to ask you directly, have you ever noticed your blood pressure rising? Or felt unexplained dizziness? Or struggled with habits like smoking or heavy drinking? Share your experience in the comments, because your story might be the very reminder someone else needs to take action before it is too late. 1. Blocked blood vessels in the brain. Ischemic stroke. The most common cause of stroke, responsible for nearly 9 out of 10 cases, is a blockage in the blood vessels that supply the brain. This condition, called ischemic stroke, occurs when the flow of blood is suddenly cut off, depriving brain cells of oxygen and nutrients they desperately need to survive. Within minutes, cells in the affected area begin to die. And the longer the blockage remains, the greater the damage becomes. Blockages can develop in 2 main ways. The first is thrombosis, in which fatty deposits, cholesterol, and inflammatory cells gradually build up on the walls of an artery. This buildup, known as atherosclerotic plaque, narrows the vessel and restricts blood flow. Over time, the narrowed vessel becomes vulnerable to clot formation. And a clot that develops at this site can completely obstruct circulation to part of the brain. The second mechanism is embolism. In this case, a clot or piece of debris forms elsewhere in the body, most often in the heart, and then travels through the bloodstream until it becomes lodged in a smaller artery within the brain. People with atrial fibrillation, a common irregular heartbeat, are at particular risk because blood tends to pool in the heart chambers, making clot formation more likely. Once released into the bloodstream, these clots can reach the brain within seconds and cause a sudden stroke without any prior warning. The tragedy of ischemic stroke is that the symptoms often come on quickly and without pain, so patients may not recognize the danger until it is too late. A drooping face, sudden weakness in the arm, slurred speech, or abrupt loss of vision can all signal that a vessel is blocked. Even if these symptoms disappear after a few minutes, it is a mistake to ignore them. These so-called mini-strokes are actually transient ischemic attacks, and they often precede a major stroke in the days or weeks that follow. The good news is that understanding the causes of blocked vessels gives us clear strategies for prevention, managing cholesterol levels through diet and medication, controlling blood pressure, staying physically active, and treating heart rhythm problems are all proven ways to reduce the risk. Quitting smoking is equally critical, as tobacco accelerates the buildup of plaque and thickens the blood, making clots far more likely. Think of your arteries as the highways that carry life to your brain. Each fatty deposit or clot is like a roadblock forming in secret, waiting to stop traffic completely. By addressing these risks early, you can keep those pathways open and protect your brain from sudden catastrophe. Ischemic stroke is common, but it is not inevitable. With vigilance, awareness, and medical guidance, it can be prevented, and the tragedy of a blocked artery can be avoided. 2. Bleeding in the brain hemorrhagic stroke. While less common than a blockage, a hemorrhagic stroke is often more deadly. This form of stroke occurs when a blood vessel inside the brain ruptures and begins to leak blood into the surrounding tissue. The result is a double assault. First, the area of the brain supplied by that vessel is deprived of the oxygen and nutrients it needs. Second, the leaked blood builds up as pressure inside the skull, compressing delicate brain tissue and disrupting function throughout the nervous system. Unlike an ischemic stroke, where the problem is a blocked highway of blood, in a hemorrhagic stroke, the highway itself collapses and spills its contents, flooding the brain. The causes of this rupture vary, but the most common is long-standing high blood pressure. Years of elevated pressure weaken arterial walls, especially the small vessels deep within the brain, until one day they can no longer withstand the force and they tear open. Another common contributor is an aneurysm, a bulging weakness in the wall of an artery. These balloon-like structures can remain silent for years before bursting, often with catastrophic results. Vascular malformations such as arteriovenous malformations also create fragile networks of vessels prone to rupture. Trauma, blood clotting disorders, and excessive use of blood-thinning medications can further raise the risk. The symptoms of a hemorrhagic stroke are often dramatic. Patients may experience a sudden and severe headache described as the worst in their life, sometimes accompanied by nausea or vomiting, rapid loss of consciousness, sudden weakness, vision problems, or seizures may also occur, because the brain has no room to expand inside the skull. Bleeding quickly raises intracranial pressure, leading to coma or death if not treated immediately. Even with prompt care, recovery is often more difficult than with an ischemic stroke, and the likelihood of long-term disability is higher, yet prevention remains possible. The most important step is strict control of blood pressure, regular monitoring, adherence to prescribed medications, reduced salt intake, and daily physical activity all reduce the strain on blood vessels. Avoiding smoking and limiting alcohol intake also protect vessel walls. Screening for aneurysms or malformations may be appropriate in those with a family history of vascular disease. In some cases, surgical procedures can repair fragile vessels before they rupture. Think of the vessels in your brain as delicate pipes carrying life-giving fluid. High pressure, weak walls, or hidden defects can cause those pipes to burst without warning, flooding the system and destroying vital circuits. By taking care of your vessels today, you protect yourself from this sudden catastrophe. Hemorrhagic stroke may be less common, but its consequences are often more severe. Awareness, careful management of risk factors, and timely medical care can mean the difference between life and death. 3. Heart attack and its link to stroke cardiac causes. Many people are surprised to learn that a heart attack and a stroke often share the same underlying causes and can even trigger each other. A heart attack, also called myocardial infarction, occurs when the blood supply to the heart muscle is suddenly blocked, usually by a clot in the coronary arteries. Just as in the brain, when circulation is cut off, the affected cells begin to die within minutes. But the story does not end with damage to the heart. The same clotting process that causes a heart attack can also send fragments into the bloodstream that travel to the brain and cause an ischemic stroke. This is why people who suffer from heart disease face a much higher risk of stroke, sometimes within days or weeks of a cardiac event. Atherosclerosis, or the buildup of fatty plaques in the arteries, is the common thread in the heart. These plaques form in the coronary arteries, while in the brain they develop in the carotid and cerebral arteries. When a plaque ruptures, the body attempts to repair the injury by forming a clot in the heart. This causes a heart attack. In the brain, the same process produces a stroke. The connection becomes even stronger in people with atrial fibrillation, a type of irregular heartbeat that causes blood to pool inside the chambers of the heart. When blood stagnates, clots are more likely to form. These clots can break loose and travel directly to the brain, blocking an artery and triggering a sudden stroke. Without treatment, these embolic strokes can cause devastating damage in seconds. The symptoms of cardiac-related strokes are the same as other types, including sudden weakness, slurred speech, vision problems, or confusion. However, they may be preceded by chest pain, palpitations, or shortness of breath that signal underlying heart disease. Prevention must therefore address both the heart and the brain together. Managing risk factors such as high blood pressure, high cholesterol, and diabetes protects not only the arteries in the heart but also those in the brain. Medications such as blood thinners may be prescribed to people with atrial fibrillation or other high-risk heart conditions to prevent clot formation. Lifestyle changes including a heart-healthy diet, regular exercise, quitting smoking, and limiting alcohol intake strengthen both systems at once. Think of the heart and brain as two vital engines connected by the same fuel lines. When one engine fails, the other is placed under immense strain. And when the fuel lines are clogged or leaking, both are at risk. Protecting one means protecting the other. A heart attack is not only a crisis for the heart, it is a warning that the brain may be next. By treating cardiac disease with seriousness and consistency, you greatly reduce the chance that it will trigger a catastrophic stroke. Awareness of this connection empowers you to see heart health and brain health as inseparable parts of the same system, both deserving constant care. 4. The major risk factors you must watch. When it comes to stroke, the event itself may feel sudden, but the risks accumulate slowly over years, often hidden until it is too late. Understanding and managing these risk factors is the most powerful way to protect your brain. The first and most important factor is high blood pressure. Constant pressure on artery walls weakens them over time, creating tiny injuries that encourage plaque buildup and clot formation. High blood pressure also increases the likelihood of a vessel bursting, making it the single greatest contributor to both ischemic and hemorrhagic strokes. Many older adults live with hypertension without realizing it because it rarely causes symptoms. That is why regular monitoring is essential. Another critical factor is high cholesterol. Excess levels of low-density lipoprotein, often called bad cholesterol, infiltrate artery walls, and form plaques that narrow the vessels. When one of these plaques ruptures, the body responds by creating a clot, which can instantly block circulation to the brain. Diets rich in processed foods, animal fats, and sugars accelerate this process, while healthier diets full of vegetables, fruits, and whole grains can reverse it. Heart disease, especially conditions like atrial fibrillation, adds another layer of risk. Irregular heartbeats create turbulence in the blood, encouraging clots to form in the heart chambers. These clots can travel directly to the brain, causing an embolic stroke. People with atrial fibrillation have several times the risk of stroke compared to those with normal rhythm. Yet with treatment and medication, this risk can be reduced dramatically. Diabetes is another dangerous contributor. High blood sugar damages the lining of blood vessels and makes blood more prone to clotting. Over years, this constant damage leads to atherosclerosis, narrowing vessels in both the brain and the heart. Poorly controlled diabetes doubles the chance of suffering a stroke. Yet careful management of blood sugar through diet, exercise, and medication can greatly reduce that danger. Obesity amplifies nearly all these problems. Extra body weight raises blood pressure, increases cholesterol, and worsens blood sugar control. It also places additional strain on the heart, forcing it to work harder with every beat. People who are overweight or obese face significantly higher stroke risk, but losing even a modest amount of weight can improve all related conditions at once. Smoking is one of the most preventable risk factors. Every cigarette damages the arteries, accelerates hardening, and thickens the blood. Smokers are roughly twice as likely to suffer a stroke compared to non-smokers. The good news is that quitting begins to reverse the damage almost immediately, and within a few years, the risk can approach that of someone who has never smoked. Excessive alcohol consumption also raises blood pressure and damages the liver, adding further strain. Beyond these medical and lifestyle issues, age and family history also matter. Risk rises steeply after the age of 55. And those with relatives who suffered strokes face a higher chance themselves. Gender plays a role too, with men experiencing earlier strokes and women often facing more severe outcomes. The message is clear. Stroke does not appear randomly. It is the result of a network of risk factors that can be measured, monitored, and controlled. By knowing your blood pressure, cholesterol, blood sugar, and weight, and by making healthy choices each day, you take control of your future. Awareness turns a silent threat into a manageable challenge. Ignoring these risks leaves the brain vulnerable to a sudden, life-altering catastrophe. 5. How to lower your risk and stay protected. The hopeful truth about stroke is that while it remains a leading cause of death and disability, much of the risk can be reduced with consistent, deliberate action. Lowering your risk is not about a single miracle cure, but about building a lifestyle that protects your brain every day. The first step is proper management of underlying conditions. If you have high blood pressure, diabetes, high cholesterol, or heart disease, you must follow your doctor's treatment plan carefully, taking medications as prescribed, attending regular checkups, and monitoring your numbers at home are not optional. They are life-saving practices. Even slight improvements in blood pressure or blood sugar control can dramatically reduce the likelihood of a clot or a vessel rupture. The second step is adopting a brain-healthy diet. Limit salt and sugar intake, as high levels of both drive up blood pressure and cause inflammation in the vessels. Avoid processed foods, fried fast foods, and fatty meats. which clog arteries and accelerate plaque buildup. Instead, focus on a diet rich in fresh vegetables, fruits, whole grains, fish, and lean proteins. Drinking enough water, choosing plant-based oils instead of butter, and keeping alcohol consumption minimal will all strengthen vessel health. A heart-healthy diet is also a brain-healthy diet because the same arteries that feed your heart also feed your brain. Physical activity is another cornerstone of prevention. Aim for at least 150 minutes of moderate exercise each week, or about 30 minutes most days. Walking, swimming, cycling, or even gardening can lower blood pressure, improve cholesterol levels, and keep weight under control. Add strength training and flexibility exercises to preserve muscle and balance, reducing the chance of falls and supporting independence. Smoking must be eliminated entirely. No amount of tobacco is safe. The moment you quit, your body begins repairing itself, and within years, the risk of stroke decreases significantly. Alcohol should be used cautiously, if at all, with strict moderation. Stress management is equally important because constant stress keeps blood pressure high and promotes harmful habits like overeating or smoking. Techniques such as deep breathing, meditation, yoga, or simply spending quiet time in nature can calm the nervous system and give the arteries much needed relief. Social connections also matter more than many realize. Loneliness and isolation contribute to depression, unhealthy behaviors, and increased stroke risk. Staying engaged with family, friends, or community groups not only lifts the spirit, but also reduces biological stress on the body. Finally, make regular health screenings a lifelong habit. Early detection of aneurysms, irregular heart rhythms, or vascular abnormalities can allow doctors to intervene before disaster strikes. Think of prevention as building a shield. Each healthy meal, each walk, each night of restful sleep, each decision to avoid harmful substances adds another layer of protection alone. These actions may seem small, but together they form a barrier strong enough to protect your brain for years to come. The power is in your hands. By lowering your risks step by step, you can prevent a sudden catastrophe and preserve your independence, your memory, and your life. Doctor's final words. As a brain doctor, my final message to you is this. Stroke may feel like a sudden strike of fate, but in truth, it is the result of causes and risks that can be recognized and controlled. High blood pressure, diabetes, heart disease, cholesterol, smoking, poor diet, stress, and even loneliness are not abstract concepts. They are silent forces that slowly weaken your arteries and set the stage for a catastrophic event. The danger is real, but so is the hope. Every step you take to manage your health reduces the chance of a stroke. Following your doctor's advice, checking your numbers, eating wisely, staying active, and avoiding harmful habits are not just small tasks. They are powerful shields that protect your brain. You may not see the benefit immediately, but with time, these choices add up to years of independence, clarity, and strength. Too many people ignore brief warning signs, dismiss dizziness, slurred speech, or numbness, and only realize the seriousness when it is too late. Do not let that be your story. Treat every warning sign as urgent, and treat every healthy choice as an investment in your future. I encourage you to share your own experience in the comments. Have you or someone you love ever faced high blood pressure, diabetes, or a mini stroke. Your story may inspire another person to act before disaster strikes. Remember, prevention is not about perfection. It is about persistence. Stroke can take away speech, mobility, and independence in seconds. But prevention can give you decades of life with dignity and clarity. The decision rests with you. Begin today. Take control of your health and give your brain the protection it deserves.